Good Sunday morning. I'm Shannon Sims.
And I'm Charles Benson. Welcome to 4-1 Forward.
From today's TMJ4, this is 4-1 Forward.
Well, in an effort to repeal the Affordable Care Act, Speaker Paul Ryan has vowed Republicans will seek to defund Planned Parenthood.
News of stripping the medical provider of federal dollars has supporters of Planned Parenthood protesting and petitioning the Janesville congressman to reconsider his position.
Protect women! Protect Planned Parenthood!
More than 50 doctors and medical students from UW-Madison traveled to Speaker Paul Ryan's Janesville district to voice their concerns against his plan to defund Planned Parenthood.
Our only agenda item is the health of our patients. That's why we're here.
Maggie Smith is a second-year med student who fears the ramifications of such a move.
Fundamentally, I believe, as well as a lot of my colleagues believe, that healthcare is a human right.
The Speaker's plan would go after federal dollars Planned Parenthood receives from Medicaid reimbursements and Title X funding. By law, these allocated funds cannot be used for abortion services. The Congressional Budget Office reports federal defunding would mean cutting off basic health care options for hundreds of thousands of low-income women. Planned Parenthood Wisconsin claims nearly 50,000 Medicaid patients would be impacted if federal funding was stripped from the provider.
I would be so grateful if some of my tax dollars go to promoting the health of women and their reproductive rights.
Those in support of defunding Planned Parenthood believe women have other options for care through federal qualified health centers.
And it's true, there are a ton more FQHCs than there are Planned Parenthoods. Speaker Ryan is correct on that. But they're not really equipped or prepared to handle the thousands, if not millions, of extra patients who will be coming to these centers if Planned Parenthood's closed.
Now, there are real people who will be impacted by the Planned Parenthood being defunded.
And one of those could be Tamika Vukovic. She's a Planned Parenthood patient. You know far too well what this could mean. Just tell us why you decided to use Planned Parenthood.
Well, originally, there's two separate reasons and very important reasons why I used Planned Parenthood. The first one, when I was 19 years old, I was in college and I was having pain, so I went to a Planned Parenthood clinic, found out that they did an ultrasound and found out I had a big lump in my fallopian tube. Told me to get to a hospital right away. When I got there, the doctor said I probably would have had about 5 hours to live if I had not got to Madison and had the surgery. So I believe an uninsured college student, this had nothing to do with anything else other than health care. The second one is a little bit funnier, is because I was 31 years old when I had my first child, or when I got pregnant with my first child, and I called the doctor and I was feeling bad, couldn't get in for 3 to 4 weeks. So what I did was I ran to Planned Parenthood. They had an appointment. I went in and they gave me my pregnancy test. I walked out because I didn't believe him and forgot. I had to turn back around and say, "Did you just say I was pregnant?" But it was the convenience of it as well as the monetary value of it.
So when you hear that lawmakers want to defund Planned Parenthood, what impact will that have?
It'll have impacts on many, many women, and not just low-income women. It's convenience. It's all about making sure that sometimes you're comfortable. You may not be comfortable going to your regular doctor just because it's right there. It's inexpensive. If you don't have insurance, it's sliding scales. They have ways to make sure it does take private insurance, but basically what you're doing is you're giving a service, and when you use services, you go to the specialists. Planned Parenthood is a specialist of women's health, and that's where you want to go. I plan on taking my daughter there because her pediatrician does not do like some of the preventative care, pap smears, things of that nature. So I plan on taking them to there because I know they are qualified and they're good at what they do.
Do you understand, though, how some feel that federal money should not go to Planned Parenthood?
Planned Parenthood is not a Republican or a Democratic place. Women of both sides of this aisle has gone to Planned Parenthood, and I don't know why it's such a burden to say everybody uses it, because someone and everybody on the Republican side as well as Democratic side, independents, they've all used it or they know someone who's used it.
So what would you say to someone who says Planned Parenthood is an abortion clinic?
Planned Parenthood is so much more than abortions. That is just a small part. I've used them 2 or 3 times. That's not what I use them for. So my daughter will be using it. I know kids, my nieces use it, you know, just for health care. It's so much more than abortion. This is a small part of it, and it's the reality of it all. Some people don't have doctors. We don't have private doctors, don't have insurance. This is a place you can go on a sliding scale and you can actually get the care you need without, you know, breaking the bank.
Especially if you don't have insurance. And when you're young, like you said, at 19 was your first encounter with Planned Parenthood, you didn't know where else to go. And you were serviced quickly, conveniently, and you felt comfortable and safe. Is that fair to say?
Exactly. Planned Parenthood has done so much. They're advocates to any rights that we have. I mean, they have been doing advocacy work. They're working on trying to help with the family leave and paid leave. They're doing so much more than that, than just quote unquote providing abortions. It's bigger than that.
We appreciate your insight on this important topic. Coming up, is there any common ground when it comes to those who are for or against Planned Parenthood?
We'll ask that question to 2 key people who have opposing views on the issue. All right, let's go ahead and jump into this important conversation with 2 people well-versed in the subject.
Yes, we have Tanya Atkinson. She is with Planned Parenthood, and we have Julaine Appling with the president of Wisconsin Family Council. Both of you are well-versed on this subject. The debate here, though, is whether or not Planned Parenthood should continue to get federal funding or be defunded. Tanya, let's start with you.
Great. Well, good morning. Thank you so much for having me. I appreciate it. First, I'd like to talk a little bit about defunding and what that means. There is not a line item in the federal budget that goes directly to Planned Parenthood. What's being proposed is related to people's Medicaid insurance or Badger Care insurance here in Wisconsin. And what that would mean is that people who, you know, families who are struggling, people who are working hard and they may need some health care insurance through the form of Medicaid and Badger Care, they wouldn't be able to come to Planned Parenthood because we wouldn't be able to bill Medicaid. So again, this is about blocking individual patients' access who use Medicaid as their insurance from accessing care at Planned Parenthood, and that care is prevention care. So it's cancer screenings, birth control, STD testing and treatment.
Can we just bring up just some numbers, because last year you had a total of over, I think it was 56,000 patients who are either partially insured or fully insured by Medicaid and Medicare. I think we even have a graphic about that just to kind of show the difference between how many people are funded or supported with that Medicaid information that you just spoke of, and then how many people also get services of abortion last year. That was close to 4,000 out of the 59,000 you served. Is that correct?
Correct. And we have about 50,000 patients out of our 60,000 who are eligible for Medicaid.
Julaine, so you hear this side of their argument. Do you think that they are providing mainly medical services to women?
Well, first of all, let me join Tanya in saying thank you for the opportunity to talk about this. It is an important topic. No, I don't. Look, you know, if you look at the history of where the vast majority of their work has been, the money that's come in has come in primarily through abortion. They don't do a lot of medical services. But let me say this. Right now, there are only 18 or 19 Planned Parenthood facilities here in Wisconsin. Meanwhile, we have federally qualified health centers to the tune of over 120. Spread throughout the entire state. Most of their facilities are in heavily populated areas, and the federally qualified health centers are spread all the way across border to border, top to bottom. You can find those. And so those 60,000 people that have found services through Planned Parenthood have many, many opportunities to go to other places where they don't perform abortions. Let's remember that the reason that the populace is calling for the defunding of Planned Parenthood is because of the abortion factor.
And let's make it clear, though, there are no federal dollars
that go to abortion services.
But money's fungible. Let's be honest.
Talk about
all funds are fungible. Fungibility means when you get money for one thing, it frees up money for other things. And so what the what the people are saying, and I believe what a number of legislators are beginning to say at the federal level, and we've already said this at the state level here in Wisconsin, is if Planned Parenthood wants to provide medical services and if they want to provide abortions, that is certainly their right to do that. But we don't need any federal money going to an organization whose primary function is in the abortion area, which is the most problematic of what they do.
Respond to that, Tanya, because we just showed a graphic that showed probably about 6% of their clientele last year received abortions. So I get the moral aspect of it, but explain to me how you can say the majority of what they do services abortion if that's only 6% of who they serve.
We're talking about income. Not the numbers of people, but the majority of their income comes off abortion services.
That is inaccurate. There was a lot there, so let me peel some things away here. We do provide a lot of health care. We provide a lot of prevention health care. So it is not correct that we don't provide a lot of health care. We provide cancer screenings, we provide birth control, we provide STD testing and treatment to, depending on the year, between 60 and 70,000 individuals, unduplicated patients every year across the state. The vast majority, as you could see from the graph, of our services are prevention services. We're part of a safety net network of providers. So the providers who are out there for people, again, families who are struggling, who are look to Badger Care, they look to Medicaid to get some basic health care. So when you have a provider like Planned Parenthood and you take us out of that tapestry, out of that network of providers, it does leave a gap. And a study just came out this week that shows that the gap is not able to be filled. In 50% of the counties where we have healthcare centers, and we do have healthcare centers across the state, and in 50% of the counties where we have healthcare, we are the only reproductive health care provider in that entire county.
All right, we're going to talk about that gap and sort of what needs to be done and what's happening out there, because the funding battle over Planned Parenthood will be fought in D.C.
And coming up, we talk with a number of Wisconsin lawmakers who claim Planned Parenthood doesn't really provide health care services, and we also talk with the other side of the debate who has sparked this public outcry. Well, welcome back to 4-1 Forward. Republican lawmakers in Congress are promising to defund Planned Parenthood. Republicans like Congressman Sean Duffy say if Planned Parenthood really wants to help women with health care, get out of the abortion business. Take a listen.
And I think you're going to see some evidence come out in the next week or so. You can call your Planned Parenthood facility and ask them to get a pregnancy screening. They don't do it. So what we say is, listen, if you don't want to do abortions, we have all the money. We'll put more money into women's health care, and especially for those who can't afford it.
So, Tanya, you think that's the argument? I mean, he's saying separate your business.
We offer the full range of reproductive health care for women across the state of Wisconsin. It's needed, it's necessary, it saves lives. And we do provide health care that people need, absolutely 100%.
You can get a pre-screening test?
Is it a pre-screening test or is it a pregnancy test?
We do pregnancy tests, yeah.
Okay.
And I think that, you know, what I wonder is when birth control became so political. I understand people have complicated feelings about abortion, and I respect people's complicated feelings about abortion. If we want to reduce unintended pregnancy and abortion, then we should increase access to family planning. And it is very clear from the counties where we've had to close health centers, there have not been other providers to come in and provide those resources. So we can say over and over again that there's other providers out there where people can go. We're part of a safety network of providers that provide people services, people who are struggling financially. So if we go away, there's going to be a gap, and that gap is very, very difficult, if not impossible, to fill.
Jelaine?
That gap is partly created because the money that comes through the Title X program has been going exclusively to Planned Parenthood of Wisconsin for all the years of its existence. And now with the bills that we've passed here in Wisconsin, well, at least the state is required to apply for that money. Some of these places have gaps because there's no money there for the healthcare centers to fill that gap. Look, you have to come back. I think Representative Duffy was exactly right. If you want the federal money, then back away from the abortion business at all. Look, this is an organization that has, we've shown here in audits in Wisconsin, they've overbilled for various services and drugs. We've seen that at the national level. There have been 2 reports issued from the U.S. House and from the U.S. Senate over the last month that have showed a number of important problems the sale and use of the body parts of aborted babies for profit. We've seen what just recently the U.S. Senate report from the Judiciary Committee came out and said they think there should be charges brought to Planned Parenthood Federation of America and some of their vendors.
You need to respond to that.
Yes, I do. We can make assertions all day long. It doesn't make them true. We've been under such a level of scrutiny, such a level of investigation. It has been shown time and time again that Planned Parenthood takes our role very seriously. We are very, very dedicated to our patients, and we are very, very responsible stewards of Medicaid funds, of Title X funds, which we do regrant to other family planning providers in the state. So they're not exclusively our funds. That's part of our responsibility. So we can say these things over and over again. It does not make them true. And a number of independent polls have come out that the vast majority of Americans believe that Planned Parenthood should keep the funding. 1 in 5 women have been through our doors. They know us. They have a relationship with us. They know the services that we provide. And the public has spoken resoundingly that those services are still needed. Public health officials have made it very clear those services are still needed. So Planned Parenthood is needed, and we are extremely respectful of the systems that we participate in.
We want to hear from one more lawmaker. Democrats don't have the votes to stop the Republican efforts to end federal funding for Planned Parenthood.
So what can they do? Congressman Mark Pocan says makes a lot of noise.
People really get upset about the changes to reproductive health care access, or if they really get upset about if you're going to have big cuts to things like food stamps that Republicans in Congress really want to do, then they got to speak out and call us and honestly get in our faces. That's how you get our attention.
But one thing we're not touching on, I just want to say, is that in order for the Republicans to repeal the ACA and to have it also include the defunding of Planned Parenthood, they need to have enough votes. They do not have enough senators to pass this when they have 2 Republicans who have already said if Planned Parenthood is connected to the ACA repeal, they will not vote for it. Those are 2 Republicans who are pro-choice.
So just with a few seconds we have left here, do you expect a big battle?
I do expect a big battle, and just as Representative Pocan said, we all as citizens need to make our voices heard.
Definitely, I agree.
Yes, I absolutely agree with that.
We found agreement on one issue. Right. Thanks. Coming up, dress for success. He's been styling Milwaukee men for 50 years.
The reason why the owner of Harley's, a store for men, decided now it's time to retire.
Well, he was a haberdasher for half a century. He started his journey in college and then became a co-owner.
But now, Tim Ryan of Harley's is calling it a career in selling men's suits.
Harley's has been in business for almost 69 years, and I've worked at Harley's for almost 50 years. So this has been my only adult job. And then there's also some Talbot shirts on a special price over on that rack. You know, it's a personal business, it's not an impersonal business. Saw your mom yesterday. I'm retiring. We probably got people that are 50-plus year customers that are still around, and then some of those people, their kids and their grandkids are clients as well.
Oh my gosh, it was way back in 1954. I was a teacher at Sherwood High School then, and I had to get some better looking clothes, so I went to Harley's.
Probably one of the, I think, most rewarding things and fulfilling things about the business is that you are not just selling product to somebody, you're actually developing a relationship with people. Yeah, well, she retired in October, so she's taking advantage of it. And that's what I'm looking forward to doing too. 2.5 years ago, I got diagnosed with a very rare genetic protein deficiency called alpha-1 antitrypsin deficiency. And antitrypsin is a protein that kind of manages white blood cells, so when they're not battling infection, they're kind of kept under control so they don't do harm to your body. And unfortunately, I don't produce enough of this protein, so it caused a condition to my lungs. So I've lost some of my lung volume. It kind of changed my outlook on things because it's not, I'm not 100% healthy. And so I started looking at, well, I've got this condition and, who knows where it's going to go going in the future. Right now it's maintainable, but it is not curable. And so it gave me a different outlook on life. I'm actually excited because I think this is what all of us in life work towards. So it's a goal that I think most people have, and I'm grateful that I'm in a position to reach that goal and take the next step. I'm looking to have Harley's continue, but just Harley's continue with new leadership.
Congratulations to him
Yeah.
for 50 years. I mean, 50 years to stay in one business. And if you want it to be in style,
Right.
in Milwaukee, Harley's was a place to go. And what a name for Milwaukee, right?
Yes.
To have a suit store named Harley's.
After, yeah.
Right. So, you know, if you're in town, you know, new, and you're like, hey, there's that Harley's. Can I get a Harley there? No, you can get...
Can I get a Harley there?
You can get a nice suit there.
You can get a nice suit there. Well, today we had a full table of conversation, wouldn't you say?
And with this, the benefit of this show, the 4-1 forward, to move the ball forward on a big issue. And defunding Planned Parenthood and Planned Parenthood is going to be an issue in this new Congress, with this new president. And so you got a perspective today on what people are thinking about it and what might happen down the road.
And we shall see. And I'm sure we'll have this conversation again.
Yeah, let us know what you want the conversation to be. Just drop us a line.
#414.